Neuroendocrine cancer, the cancer that Steve Jobs and Aretha Franklin died of, is what we're talking about next. It's a rare cancer that still receives very little publicity despite the rising number of Australians who are living with it. Frequently misdiagnosed, more common diseases such as irritable bowel syndrome, menopause, or also anxiety. And that means that by the time that patients are correctly diagnosed, many have stage 4 cancer. Joining us to discuss this is Simone Leyden, the CEO and co-founder there. Thanks so much for your time.
Thank you so much for having me.
Now, as a news anchor, I got to say, I have no idea how to pronounce this cancer. Can you do it for us, please?
So it's neuroendocrine, and yes, you're so correct. It is very difficult to pronounce, and I guess that's probably one of the key reasons why we haven't probably made the strides in awareness that we've hoped to over the time, because it is difficult to say. But as you mentioned, it is on the rise, and it is a cancer that has affected some of the more famous people in the world, but obviously everyday Australians as well.
It's interesting, we think of Steve Jobs and his battle, and obviously he lost a lot of weight during that period as well. We would see him periodically as he'd appear on stage, and his appearance would suddenly change. Is appearance quite often the first thing that people notice? Because in my introduction there we speak about anxiety and irritable bowel syndrome, etc. But that really tragic weight loss seems to be a pretty common symptom.
It is. Look, especially as you mentioned, it has such varied symptoms, and hence why it's misdiagnosed. So irritable bowel is definitely one of those. Interestingly, with Steve Jobs, it is misconstrued that Steve Jobs and Aretha Franklin had actually pancreatic cancer, but it is pancreatic neuroendocrine cancer.
And how does it differ? Just explain how it differs, because as an Apple lover, I was very saddened obviously by the loss of Steve Jobs, and I, until you have just said it now, thought he had died of pancreatic cancer.
Absolutely. So pancreatic cancer as a cancer is very devastating, and obviously we haven't had much success in survival rates. With pancreatic neuroendocrine cancer, neuroendocrine tumours affect about 5% of those overall pancreatic diagnosis. So it is the better pancreatic cancer to have, but it is the more rare. So there's more treatment options, and patients do live longer. So with Steve Jobs, for instance, he lived for about 5 years, and Aretha Franklin actually lived for 12 years with pancreatic neuroendocrine cancer. So it is a bit more slow growing, and as I mentioned, there's more treatment options, but it is very different, and it secretes different hormones and acts very differently to the more common pancreatic cancer. So the pancreatic is definitely one area. We also see these tumours appear in the lung, right throughout the gastrointestinal system, but also right throughout the endocrine system. So anywhere where your body is secreting hormones, your ovaries, that sort of place, these tumours can appear. So pretty much it's like a subset of the more common cancers that you see.
So why is it not more commonly diagnosed, and why does it take so long? Why don't doctors look for it? Is it because it's too difficult? I mean, this is a pretty big failure if that's the case.
It is, and look, it's probably, in fairness, there hasn't been the education. There hasn't been the education throughout the medical world, and that's something we're definitely focusing on this year with some around GP education. I think it's also because the symptoms are so common. If you present to a doctor with, nausea or stomach pain or that sort of thing, or, with other cancers, you present with a lump, it's automatically sort of picked up. But because these symptoms, even anxiety, because again, the serotonin that's secreted in these tumours, doctors do just suspect, oh, well, it's the more common ailment, or it's the common solution. So what we actually are really trying to push for is that if you see a patient presenting too many times with something like this, please send for an ultrasound, a CT scan, even a PET scan, and this is how these tumours are actually picked up.
It's funny that it's kind of up to the patients to push for this, though, isn't it?
It is. And look, this is what we've always done. We launched the Neuroendocrine Cancer Australia, or previously the Unicorn Foundation, 10 years ago, and it was about empowering patients to ask the questions, to try and be their own advocates in raising awareness about this. And again, I think it goes back to the fact that because it's a difficult disease to understand, because it sort of appears everywhere, we don't own an organ, we own a whole system, it hasn't probably had the ability to raise that awareness, and even with the primary healthcare and the GPs picking it up earlier as well.
So what are the services that you actually provide at your organisation?
So because we're the only not-for-profit medical society in Australia, not-for-profit here in Australia, we do the gamut. So we actually do support, research, education, awareness, and advocating for new treatments. So with support, we have a specialist neuroendocrine tumour cancer nurse who runs our helpline and runs all our support groups.
Yep.
We also fund clinical trials, and we have our own neuroendocrine tumour registry in all the really important hospitals throughout Australia.
Yep.
We also educate and raise awareness, and thank you. This is exactly what we need to do with raising awareness.
Yeah, absolutely. And what's this virtual walk as well that you've developed?
Look, so I guess just like everybody, when we were hit with in March going, oh goodness, what is going on? We're having to stay home. We didn't want our patients already feeling isolated to feel even more isolated. So we came up with a virtual walk, and we're happy to say we have nearly 200 patients who have walked over 27 million steps. So the whole of the Australian mainland, we've walked virtually. It wasn't a fundraiser. We know times are tough. This was more about awareness and connection, and feeling connected through this isolating time. And they've been posting pictures about where they live, and it's just been beautiful to see. And it's been a real moral booster. And I think most importantly for patients who haven't had the desire to get out and exercise, and we know how important exercise is for cancer patients, they've got out there and they've got their dog or their partner, and they've really pushed themselves, and it's been beautiful to see.
Interesting, we talk about the big names. You mentioned Aretha Franklin and obviously Steve Jobs. Quite often when you see prominent people who are going through some sort of particular type of cancer or illness, a lot of people, it raises awareness in itself. Did it in this case, do you think, or is it only now that we're starting to talk about it?
Oh, look, I think it does for a little while, but then it sort of obviously drops off the radar. But unfortunately, on Wednesday, we lost Irrfan Khan, the famous Bollywood actor from the likes of Slumdog Millionaire. And he was diagnosed in 2018, and he went out of his way always to sort of bring his fans or the press along on the journey, and he always stated that it was neuroendocrine tumour that he had. Unfortunately, now we probably realise he had a very aggressive form, because we can go from slow growing to very aggressive with this disease. So unfortunately, he had a very aggressive form, but